2 years ago, I was in a road traffic accident. A motorbike hit my right ankle, resulting in 2 shattered bones, and 2 weeks in hospital resulted in 3 quite serious scars on my right ankle. Going into surgery, they were going to amputate the foot. Coming out of surgery, they thought at best that I would be very arthritic, very painful. So after the surgery, after coming off all the various painkillers, etc., I was surprised to find that I wasn't in a huge amount of pain in the joint. Clearly surgical pain was still existing. The first thing I did was to go and see a physio, and I was lucky enough that the physio recommended Emma. When I went to see Emma, I was struck actually by the very different techniques you were using to aid my recovery. What I found was that the physio was very good at the mechanics, but Emma was very good at trying to separate the scar tissue from the injury itself. And what I've come to realise is that scar tissue and that physiological mobility are absolutely linked. It's a real positive recovery. So when I look at recovery, as I say, there are 3 things that are going on here. There's the physiological recovery, the psychological recovery, and the acceptance of the recovery. You have to come to terms with that trauma. And people will do that in different ways. But for me, working with the scar tissue, understanding what the scar tissue was doing and understanding what happened was a great way to accept what's happened and for me to move on in life. Where I think the technical piece is with the physio who are there to build the muscles and the bones and all the various functions, the scar tissue is absolutely up there as my number 1 priority. Why? Because the scar tissue itself restricts the ability of the physio to do their job.
Absolutely.
The physio are very good at doing the muscles and the bones, but if the scar tissue won't let them, then you can't go any further. What Emma did was to loosen everything in the joint such that physios could then provide the strength in order for me to be able to walk and run. The reason I think the scar tissue is so important, especially in a joint like the ankle or maybe a hip or a shoulder or something like that, is what you're doing is releasing the scars to allow the movement of the joint. And like any animal that you look at, they don't lie down with an ankle or a foot constantly. They get up, they use it. It's that classic use it or lose it. And what the scar tissue treatment is doing is it's just giving you more access to use that joint. And what I have found, the more I use it, the better it is. I will never walk or run normally ever again. The restriction in the joint is just too great. But what I can do is I can walk to school, I can walk to work, I can run around after the kids, which is more than I could have hoped for when I was lying on the floor, being picked off the road. From a psychological perspective, what's been very useful is when someone's manipulating your scar tissue, you are forced into thinking about it. And once you have thought about it, it's much easier to come to terms with the trauma or the surgery, whatever your circumstances are. For me, it was vital in the acceptance that the fit, young, healthy me was no more, and I'm reinventing myself. And I have to say, I can't be happier.
It was really lovely for David to be so generous and kind and to share his obviously really traumatic experience and road to recovery, and I've been so honoured to be a part of that journey. What's a real shame is that the clips that I was able to use showing me actually working on David's foot were only on the scar once it was really, really mature, so it's a little bit, well, it's definitely quite a bit stronger and deeper than any work that I do on scar tissue that was immature or hadn't had very many treatments. I felt it was really important to stress that, because I know some people watch videos like this and might think that they can have a go. And also, if anybody's ever working on their own scar, I really would err on the side of being much more gentle, because the thing that you don't want to do is cause inflammation or irritation, because that can in some cases lead to more production of scar tissue, and so therefore, if anything, you really need to be a bit more gentle. Obviously, when I first met David and we were doing the really much lighter, more gentle work, I didn't know that it was going to lead to him sharing his such a lovely testimony from me. And obviously I don't generally record work that's going on in my clinic, but yeah, it was a really wonderful thing to be part of. And it just he was so determined with what he wanted to do with his recovery, and very good at following the physiotherapy advice, doing the exercises, doing the strengthening. And it's been great to see where he was able to end up. People often ask, when to start with scar therapy treatment. And although it's never too late, when the scar is immature, you've got different kind of cellular activity happening because the body's in kind of repair mode. And what's really wonderful is if you can come on and get into a clinic and access some scar therapy while the scar's still preferably under 6 months, if not under a year, because at that point the sort of final foundations for the quality of tissue hasn't quite been finished. Your body is still in regeneration mode, whereas it is definitely possible to help people with more mature scars, but it's just that the activity that's naturally occurring in a mature scar has stabilized. It's at a point at which the body's no longer making changes to it. So while it's possible that a scar therapist can come on and stimulate new changes by stimulating the tissue, that activity may well be quicker to happen and leave a better end result if you can manage to come on and work with the scar tissue while it's still immature and maturing. So just some little considerations. Certainly I wouldn't normally recommend, and it does depend on the type of injury and the type of surgery, starting before sort of 6 to 8 weeks, but really big injury that's had some complications healing is going to take longer. And certainly you may see some of the earlier images that we had there of David's scar. There were some points which didn't mature very well, that they were, because of the amount of trauma that he had and the fact that obviously down in the ankle it's quite far away from the blood supply, that meant that the scar healing is going to be less smooth than if you have a scar elsewhere in the body where you've got a more readily available blood supply and less trauma. And so he actually had to go back and get some Manuka dressing for some of those because it'd gone on too long. The scar had really dried out and become quite scabby, and if that's gone on and it's kind of more than a few weeks, really the scar should have closed over and the scab should have fallen off. And so he went back via his healthcare practitioner and got some Manuka dressings and managed to accelerate the healing and get that to close off. But that was one of the things, slow healing and chronic wound healing are things that contribute to people experiencing problems with their scar tissue, because the minute a scar isn't healing along a really nice smooth pathway of one part of the process finishing and the next one starting, the longer it gets held, let's say in inflammation or before it's fully matured and closed off, you've got more proliferation, more production of thicker scar tissue. And it's that kind of thicker, unhealthy scar tissue and adhesions, which is where tissue that shouldn't be stuck together sticks together, that tends to leave the patients that I see with these problems where the mobility is affected. It can cause discomfort, it can mean that movement's more uncomfortable to do, it could be pain, and obviously it could cause irritation around the joint, which is going to lead to inflammation. And he's already been warned, for example in David's case, that he's going to be prone to arthritis in that joint. Well, if you add more inflammation to an area that's going to be more likely to get arthritis, it's going to accelerate the potential of that happening. So anything that he can do to reduce inflammation, to make that joint as happy and as mobile and as free and as loose as possible, is going to help promote the longevity of his use of that joint. So that's wonderful. Thank you so much for watching. Do subscribe, and if anybody wants to get in touch and share their stories, always really keen to collaborate and to find out about other people. Got a new blog site going on where people can share their stories about their scars and their recovery and what it means to them. lovemyscars.com, and I look forward to hearing from you. Bye.